The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha. All right, guys. Thank you so much for joining me today. We are going to have a fantastic show. It's, June is Men's Health Month, and, we're going to talk a little bit about men and how we can get them into their optimal level of health. And this is a topic that a lot of people, just like in women's health with, menopause, there's a lot of question marks when it comes to hormones and the deficiency of hormones, and how does your body react to the lack of, or when you replacement hormones, how does your body react to it, and how does it become much more balanced? These are questions that we all have, and as we get older, we want to know more of, because we're finding that we're getting, these symptoms that are not fun. You don't understand why you may be tired all the time, why your headaches, why you're gaining weight. These are things that are usually associated with the deficiency of the optimal levels of our hormones. And so today's show, I'm bringing on two fabulous doctors whom are really geared towards balancing out your well-being overall. And with that is your hormones. And, both are medical doctors studying more of the naturopathic point of view, functional medicine we talked about in my past shows, and how important functional medicine is now more than ever when it comes to the root cause of your source of issues. So, I'm going to be bringing on two doctors who are going to talk a little bit about testosterone. And, what does it mean if you're deficient in testosterone? What are some of the symptoms? Something that might be a cause could be stress, the lack of nutrition, other indicators, maybe some kind of a diabetic situation where your body may offset your hormones. We don't know what a lot of the causes are. So there's a lot of things that come into play when it comes to your balancing of your hormones. So I'm not an expert, but, I do know that a lot of things do attest to our hormone balance. For women, when we don't have it all together, we tend to put on weight. We may have headaches like migraines and things like that, and it can become a problem. For me, this is new. I know from fitness, testosterone is a big deal for muscle strength and muscle growth. But when it comes to the other parts of testosterone, this is where I'm going to be learning with you guys. So I'm bringing on two doctors, and we're going to take a break before we bring them on. But I am going to introduce you to them just briefly. Dr. Stephen Benchouk. He is originally from Switzerland and was raised in Philadelphia, and he got his medical degree over at Pennsylvania, and his studies on naturopathic medicine and his lectures that he's done all over the world, even in China, he goes into different views of therapies. And, I've always been a big advocate on optional therapies, just because Western medicine has its place, but so does the holistic aspect of medicine. And he's definitely one of those doctors who has the best of both worlds. Also, his philosophy is in education, along with his counterpart that's going to be coming on the show. They really want to believe that educating the client is the most important. Primary focus is an underlying cause of disease, removing obstacles that impede the body's natural ability to heal. And he believes, above all, the role of the physician is to educate. And that's how I am with my clients as a trainer. I want to make sure that they know why we're doing these exercises and what happens to their body physically when they do these types of stresses that will support their joints eventually. And then we also have Dr. Carolyn Candido, and she was born and raised in San Diego. So her degree she's got in University of California, and she's also one of those true believers that integrative medicine is the form of medicine that will encompass the full spectrum of your health. I mean, integrative medicine, functional medicine, they looking at the root cause of your issues. And speaking of hormones, that could be one of your root causes. So, these guys are very well-rounded when it comes to your health. And, we're looking at, different types of aspects of your health. Dr. Candido also works, she's also an integrative dermatologist. I mean, these guys have also lectured in different arenas, and they're really big on getting that information to you. And it's such a different perspective from, let's say, Western medicine. When you go to a doctor's office, you give them some symptoms, they tell you to take this, but there's no explanation as to why you're taking a medication, why you're doing a certain type of a diet. They're just telling you to do it. These guys are different. These guys are going to educate you today, and they'll educate you if you become a client, and you'll become even more empowered to get a hold of your health. So before we bring them on, we're going to take a quick short break, and when we come back, let's get into it, okay?
The Honolulu Club is still here for you. We are providing the safest workout conditions on the island, with modified safe distancing indoor and outdoor classes, large open work floor with clean, sanitized machines and free weights. Let the Honolulu Club be your one and only fitness destination. Go to honoluluclub.com and fill out the trial pass today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the electroequiscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
All right, guys, we are back. It's all about men's health, and we're going to get some great information from these wonderful doctors that I just introduced, Dr. Carolyn Candido and Dr. Stephen Benchouk. Are you guys there?
Yes, we are.
Oh, thank you, guys. Yep. Welcome to my show. We briefly had a quick chat, but I just want to say I'm so thrilled to know that you guys exist here on the island. I've been looking for, integrative functional medicine, holistic, naturopathic, the whole gamut of another viewpoint on our health and well-being. And you guys are the epitome of that. So give us a quick, we don't know what you guys do and and that encompasses in your clinic. Tell me a little bit about what you guys do over there at your Hawaii Natural Medicine. So, Dr. Candido, can you start with us and explain to us, exactly what does the Hawaii Natural Medicine do? Because I know your guys' clinic is so versatile. I want the audience to get a taste of everything that you do there.
Yeah, I would love to. So Hawaii Natural Medicine is a holistic practice. We have both a naturopath and an MD, which is myself, and we do hormone replacement as well as weight loss and IV therapy. We're very well known for our IV services. We do mobile, and we do also currently, because of COVID, we're offering IVs in our practice to boost the immune system, help with detoxing, as well as giving people more energy to do the things that they love. So we have, for myself, I have a functional medicine background as well as a family medicine background. So I do have a more holistic approach to primary care, but I also do a lot of the functional medicine testing that is important to figure out what the root cause of disease is when it comes to people's symptoms. Because, as we all know, like fatigue it's not just, it's a symptom, but what is the root cause? And it could be hormones, it could be the thyroid, it could be toxins. So I like to do testing to figure out what the problem is and then find a holistic, natural solution, whether it be supplements, nutrition, or IV therapy.
Oh, that sounds amazing. So your mobile ability, did that begin because of the COVID mandate for people to stay home, or did you always have the mobile capability to do IV therapy for people?
We did. We've always had it, but because of our concerns for our staff, if we don't know what the status of a person that status of the person receiving IV therapy is, we don't want to send our staff members to their home. So
Got it.
we are going to continue doing that service after, the restrictions have been lifted. We'll restart that again. But right now it's safer for people to go to our office because we have we have a separate space for each patient, so we don't have any cross-contamination, so we always clean between. And first, safety is our priority. We were doing a lot of telemedicine, during the height of the quarantine, but I realized a lot of our patients want to see us. And
Right.
so, as long as we stagger and we have separate rooms, I think it's safe for patients to come back and get IV therapy or office visits because people want to have a face-to-face. They don't want to do internet medicine.
And it's a little not so personal. I get it. We thank God we have technology like this, but when somebody has an issue, sometimes the touchy-feely part of it is what some people need to feel like they're getting that treatment that they need. But yeah, for sure. But functional medicine is becoming much more understood than ever before, and I feel like people don't understand the difference between that and just regular medicine itself. Functional medicine, you're going into so many different perspectives, correct? I mean, you're looking at the gut, you're looking at the nervous system, you're looking at different things that might be the cause of someone's ailments.
Yeah, I was fortunate enough to get trained in functional medicine after I left residency. I got a scholarship in order to complete some of the coursework. And when I started my practice in San Diego, before I came to Hawaii, I had a practice that was functional medicine based for primary care. That's how I got 99% of my clients. Like they looked me up on IFM's website. Everyone heard about Mark Hyman. But when I came back to Hawaii, I realized that none of my patients knew what functional medicine was. It's interesting. Like, there's a lot of, advancements in medicine on the mainland, but when I came here, it wasn't something that was on their mind, but they always thought of it as a natural, more holistic approach. But I use a lot of data to also create my plans for my patients. So that's why I like to integrate testing, functional medicine testing, to inform my patients as well as myself of what is wrong with them before giving them. I mean, I can give them a bunch of supplements and herbs, but do I know they really need it? And I actually am conscious about the cost as well. I want to make sure patients are getting the value out of their supplements, so I want to pick the right ones, and that requires testing, and not a shotgun approach, which is something that you can do in a Western medicine approach or even in a natural approach.
So does your office offer insurance capabilities for all these testings? And some naturopathic holistic approaches aren't covered by insurance. Are you guys covered?
I am accepting Medicare, and it's going to take a few more months to accept other plans, but right now I'm accepting Medicare, and it does cover all the nutrient and heavy metal testing that I like to do because, we got to start at the foundation, especially for people who are older. We want to make sure they're getting the right nutrients, and we detox them of heavy metals to prevent things like Alzheimer's. So I'm really into doing the nutrient testing in addition to checking their hormones and their thyroid, which also contributes to their mental state as well as, their bone density and muscle, muscle tones. People, as they age, they lose muscle and they have less energy. But if you optimize their hormones, they can have higher quality of life as they age. So I really emphasize hormone replacement, and then the thyroid, it affects the mood as well as the temperature. And people who have low energy, if they have low thyroid, that could be easily replaced.
So is there any type of indication for us to understand whether the hormone issue is either the actual female male hormone problem, or is it the pituitary gland, or if it's the actual thyroid? How do you decipher that as a physician?
Yeah, so when I'm seeing a patient who is going through menopause, or for men, it's also, for men, I call it menopause, but they have andropause as well. So men have a decrease in testosterone over the age of 50, and then women also have a decrease of testosterone as well as estradiol as they age. So what causes that is just a natural process, and I think it's also the environmental toxins from our personal skincare products. They have, and there are xenoestrogens as well as endocrine disruptors that are going to, like in our food. All of the meat that is treated with hormones, that's going to also suppress your own hormone production. So it's not just at 50. I'm seeing it at younger ages, in their 30s.
Yeah, it's affecting the hormones younger and younger now.
Yeah, exactly. And usually, you should be able to have, men especially, they're experiencing low libido at a very young age, and I see it in their testosterone. So it's not necessarily from the thyroid. The thyroid can affect your mood, but it's not necessarily directly affecting your hormones. But yeah, I see toxins as well. If you think about like heavy metals in our food, like ahi tuna in our poke bowls, heavy metals also deposit in our breast tissue and prostate and ovaries, and that could also decrease the production of hormones. So
interesting.
You really have to, make sure that you don't get any exogenous hormones as well as toxins that are going to inhibit your body from producing, the hormones it naturally produces. But yeah, to that point, there are things that are, needed to produce hormones that we should eat more of, like omega fatty acids.
Yeah,
like
the good fats.
You get it from the good fats. Yeah. We have, also things that can support, besides, nutrition, we need to also decrease our cortisol levels, because that also inhibits our ability to produce hormones. Because your body, your adrenals, if they're producing cortisol, they're going to steal resources from from the hormone production. So that's what I call it pregnenolone steal syndrome. Your cortisol will steal the resources from producing sex hormones. So people under stress are going to have a lot of, they're going to feel tired, but their hormones are going to be affected, like women who have abnormal periods.
Right.
When they're under stress, it's because the stress hormones are being produced instead of the androgen hormones. So I think, stress is a huge part of why people are having at younger ages are having lower levels of hormones. And, when you're not sleeping, you're also going to have a very high cortisol level. And a lot of people aren't sleeping very well. And that's the main, one thing that I will say when patients complain about with men and women over the age of 50, when I replace the testosterone or estrogen, they'll tell me, man, I haven't slept so good in years. That's like the first thing they notice when I do replacement is their sleep quality improves. And then if you're sleeping better, you have more energy and you have a higher libido. If you're not sleeping well, you're not going to want to have sex.
Well, not only that, it affects everything, because I did a thing on sleep and what your body goes through when you sleep. Your immune system is 3 times stronger when you have an actual good night's sleep of 7 hours or more. And so I can see how that can affect your hormones.
Oh, yeah. And when you replace testosterone, the other thing that it does, it's an anti-inflammatory. it's actually it really helps with. I've given it to people who have also rheumatoid arthritis. Like, it helps people who have chronic pain and inflammation. It actually decreases that, and especially when it comes to brain fog, a lot of people complain of brain fog as they age. That testosterone, if you look at the numbers, like if you have low testosterone, or if you're a man or a woman, like, men with low testosterone are 11 times more likely to get dementia, and women as well, 3 times. If you are looking at estrogen replacement, 3 times more likely if you're not on hormone. It's protective if you're on hormone replacement for your brain. So
wow.
I mean, I think that we have to look at hormones as, it's not necessarily a fountain of youth. It's just going to maintain your cognition, your bone density, your muscle mass, so you could still be active and have your memory as you get older, because we don't want to age and just like end up in a nursing home, right? And the immune system is a huge part of that.
Right.
And if your immune system is not working, then you'll get things like COVID. So I think that hormone replacement definitely helps boost the immune system, and it helps with, it's anabolic, because instead of breaking down your bone and muscle, you're actually helping to build it up and maintain it. And you need those resources. You want to have your body needs to have like thyroid hormone and sex hormones to boost the immune system. It's definitely an important part of immune system function.
God, it's simple, but it's complicated at the same time. It's like, you know the system, you know how it works, but then at the same time, what is the cause of that malfunction is the hardest part. I don't know, is Mr. Benchouk, Dr. Benchouk, are you there? Are you able to talk?
Yes.
I don't know how
yes.
I don't know how fuzzy you're going to be coming in with your phone, but I wanted to hear your voice. You're here.
Can you hear me now?
I can hear you now. We're just trying to clean up, because you guys are calling in, and sometimes when people call in, it's like you either get this really wonderful, clear conversation like we just did with Dr. Candido, but sometimes your guys' phones is just it's a little challenge. So I appreciate that, but it's, you two are just like dynamic duo then at this clinic. So you guys are just really trying to the fact that you guys talk the way you do just now, the way you explained it to me, Dr. Candido, is so, it's like a teacher. You guys are very informative, and in the way that you want us to understand, our ailments. And I so appreciate that about you. Dr. Benchouk, what exactly is your role in the clinic for the Hawaii Natural Medicine?
Well, I'm the owner. I started the clinic about 2015, and as a naturopath, we all specialize in different things. We all train in integrative alternative care, but I focus on specific conditions or specific services. One of it has been anti-aging, which includes hormone therapy, includes IV therapy. I also do a lot of integrative cancer treatment.
Oh.
So doing things like high-dose vitamin C, holistic approaches to cancer. So we're kind of we have multiple services that we do, but the overall philosophy is pretty much the same. We're just like what Dr. Candido was talking about, hormones and things like that. Yeah, we want to empower our clients. We want to teach our clients so they can sort of heal themselves.
Right.
And we want to kind of pull back and look down from above and kind of see what's going on with the entire body, right? Not just testosterone, not just one hormone, because they all work together.
Yeah, I didn't know that androl, right, goes into progesterone and then goes into testosterone. There's this whole system, like pituitary gets started, and then you go into these female type like hormones that turn into the male testosterone. And it's all this process. And I did my homework because I wanted to sound intelligent when I talk to you. But, it's beyond that. And then you guys are talking about nutrition and the external internal stresses that can cause a deficiency of the testosterone. So when people are listening to this show, they may want to get some step-by-step. So what would you recommend to someone who, let's say a male who has a number, if they got blood work done, their blood work showed, let's say they're at 350 and they should be at 600 as far as the range goes. What would you recommend for them to do, and how would you treat someone like that?
So yeah, and the ranges are very interesting. A typical range is, say, somewhere between 220 and 1100 is one of the ranges. So why is this range so huge, right? Because they really don't know what the range is. So it's a vast range, right? So something that was 10 years ago was in the 600s is now in the 200s. They might notice that difference. Or say they were even higher than that, but they slipped down to 400. Well, it's kind of relative, right? Where were you before, and where are you now? And it kind of depends on that person's. What are the symptoms? How's his libido? We always ask people about libido, erectile function, things like that. Some of the more common questions, and then you get into sort of brain fog. Muscle to weight is huge. When we hit about 40 years old, the fat seems to build up around our midsections and things like that. We have to start watching what we eat a lot more, because when we're 20, we're like a furnace. We would just burn it off.
Right.
But as our hormones slowly decline, our body starts changing, right? Our body starts adapting to that. And so with that person, you might just want to start with, we recommend a couple different variations of testosterone replacement, and both has kind of pros and cons,
Right.
A typical one would be doing injection therapy. That works great. People seem to feel that well doing the injectable testosterone. Dr. Candido kind of bring in pellets.
Right. I heard about those.
The pellets are great. And I really almost prefer them over the creams and the injections. Creams have a sort of a limited effect on guys. They'll try a cream, and you kind of follow up with them in a couple months. They're like, yeah, maybe it's doing something. The injection, yeah, they sort of feel that one, right? I think they kind of feel that one. But the injection is you have to do it every week,
right?
To maintain the levels, right? There are a little bit more side effects. You have to watch estrogen levels.
Right.
Because if you're taking testosterone, you have this bridge called aromatase, and this will convert to estrogen. So if you're giving someone testosterone, some of that's going to convert to estrogen, so you have to watch those levels. So we do lab work and we follow up. Now, you can take something like a Arimidex or an Osphazole, very common. You just do a low dose of it. There's some natural things you can take, like DIM, CDG, calcium D-glucarate. These things will naturally help convert estrogens into weaker estrogens. But sometimes with the injections, you do need to do the pharmaceutical hormone blockers, and also sometimes the blood will sort of get what we call thicken up a little bit with the injection, so the hematocrit hemoglobin might slowly raise up. So going back to the advantage of sort of pellets, pellets is you do it about once every 5 or 6 months.
Right.
It's a one-time procedure. You don't seem to have those issues as far as estrogen going up and hematocrit hemoglobin rising as much as you do with the injection.
And how is it placed? Is it placed under the skin of some sort?
Yes. Yep. And in the buttock area, the pellets are inserted into that area. It takes about 10 minutes or so. It's a quick in and out office procedure we can do. But yeah, and then we follow up, and always following up with the client. So you want to follow up with lab work and clinically see how they're doing, see how they're feeling with that. And just like what Dr. Candido was saying before, yeah, that's one part of the picture, right? In men's wellness too. We also want to check things like prostate health.
Right.
you don't want to give someone testosterone that has prostate cancer, so you always screen that. Testosterone will not cause prostate cancer. There seems to be a misunderstanding with that.
Right.
But you wouldn't want to give it to somebody with prostate cancer, just like you wouldn't want to give a woman with an estrogen-sensitive breast cancer estrogen, right? So, we do some blood work and kind of watch those things. And there's things you can supplement with that to kind of help out. Like I said, some of the natural sort of, let's say someone has high, like a good total testosterone, but their free testosterone is low.
Yeah.
What happens when we get older, we make this protein called sex hormone binding globulin, and that raises up. And as that raises up, it binds more of that testosterone. So you might have like a normal or a good total testosterone, but your free is very low. So there's a couple options with that. You can do natural. Some natural supplements can help unbind some of that testosterone, so you have more usable testosterone.
Well, how can we activate that in see your free? Because I was told free testosterone, you can increase that by, let's say, doing heavy lifting, like, or doing weight training.
Yeah, and that I mean, that'll increase the total testosterone, right? So yeah, resistance training is key to building up testosterone naturally. It's probably one of the best things you can do naturally, as far as and exercise it's good for a lot of different areas, but it may not free up the testosterone. Things like boron, and there's an herb called nettles you can take, which actually help free up some of that testosterone, so it's a little bit more usable. But yeah, absolutely, resistance training and sleep and a good diet will also help.
What kind of a diet would you guys recommend? Like a higher protein diet? Does that matter? Because I know some people may not be into eating that much protein.
Did Dr. Candido want to touch on that?
Yeah, that'd be great.
Yeah.
I'm here. Yeah, Yes,
So,
I was not hearing the question.
no worries. The question was like, when we're talking about freeing up the free testosterone, and we were saying weight training is one of them. And in fact, it's probably good for a lot of different ailments. But to increase the free testosterone in the body, we always say food is medicine. So what would you recommend as far as a diet program? You said the good fats was one of them earlier. You talked about omega-3s, but would a higher protein diet be another one? Or what would you recommend for those clients?
I would say like a ketogenic diet, which is going to be high in fat and protein, is, for people who want to build their testosterone. It's just really hard to maintain a keto diet.
Yeah.
So you can do exogenous ketones. That's another way to do a ketogenic diet to get the same effect without having to just eat a bunch of fat and protein. I don't think that in the long run it's healthy for you to eat that way. So that's why I recommend other ways of getting in ketosis that don't require eating so much butter and meat.
Or modified, right? You can do like a modified ketogenic, that's almost paleo-like. That would probably work. Would you recommend also intermittent fasting, because that also helps bring up the ketones in the body?
Yeah, I would recommend intermittent fasting, and I mean in our weight loss program, we do a 6-hour window of eating. So when it comes to diet, if you're constantly grazing and snacking on things, it's going to increase your glucose and inflammation. And when it comes to your hormones, I think it's better to have like at least 3 meals a day. If you're going to fast, you can do, just leave off 1 meal and just do 2 meals a day.
Right.
I think it's pretty straightforward, but, the more people eat and graze, I think the more inflammation they have. So, intermittent fasting is a great way to reduce inflammation. So the body has more resources to create more, hormones instead of fighting inflammation, create hormones instead.
Well, that's true too. And then people don't understand that with intermittent fasting and eating just 2 meals a day, you're also giving your body a chance to rest from being stressed out. Because when you eat, you stress your system too, and that can cause any type of irritation in the bowels or your stomach or other aspects of your body. But I think, that makes sense to me, but I'm a different personality because I've been in the health and fitness industry for a while. I get it. But for the people out there that don't understand diet and how it works, I think your suggestions are very good. But how would they get started with it? They need to speak with someone like you who is actually a specialist in nutrition.
Yeah, we do offer multiple programs from testosterone replacement and weight loss, but when it comes to diet, it all depends on the individual. So right. I do think that intermittent fasting is something that everyone can do, and right. not, you don't necessarily have to go to a doctor, but when it comes to the actual types of food you're eating, whether it's protein, carbs, or fat, getting the proper ratio and what nutrients you should look for in your food, that could be done in our office. We could customize a dietary plan with them.
So my other question to you guys is, does gut health, gut issues like IBS, Crohn's, any type of inflammatory issues that are happening in the gut or leaky gut, can that also cause hormonal imbalances like the testosterone deficiency, or even, we're talking about men's health today, but I'm going to include us women too, or our female hormones as well. Can that cause issues?
Yeah, that can definitely cause issues. If you think about, your gut health and inflammation, this is where you're getting all your nutrients. This is where you're eliminating all your waste, right?
Right.
So, from a naturopathic, integrative standpoint, this is kind of ground zero for a lot of different health concerns. And if the gut isn't working correctly, it's one of the first things we look at and try to fix. So yeah, absolutely. So that can include lowering the inflammation in the gut. Make sure people are having regular bowel movements, not being constipated. If you're constipated, you're absorbing a lot of toxins. You're not eliminating very well. Of course, drinking a lot of water. Probiotics are also good. I always recommend people do a couple rounds of probiotics just to kind of feed the good flora in the gut. But yeah, that's definitely something that we deal with here a lot. A lot of people come to us with, let's say, IBS, Crohn's, or just just general stomach issues.
Well, it's one of those things where if your second brain, which I call the gut, now is the second brain. I think back in the caveman time, it was the first brain because we really didn't know how to cook our foods back then. But now that we can digest it better, our brain it's connected, right? The brain and the gut is like one, husband and wife. They work well together. If one is having issues, the whole system starts breaking down, and you feel it in different levels. But I think when it comes to nutrition is one thing, but then if your gut isn't working, even the supplementation that you guys were talking about, like the fish oils or the probiotics, and then the other one I was going to ask you, saw palmetto, that helps also women as well as men when it comes to testosterone, helping with testosterone buildup.
Yeah, supplemental is kind of one of those other ones that can help with that free testosterone. And then going back to nutrients too, this is a lot of times why people come in for the IV nutrients. If they have a lot of inflammation in their gut, they're not absorbing, and a good thing to do is IV vitamins, minerals, amino acids, and basically you're bypassing the GI tract and going right to the cells. So that can be very beneficial. Good
point. That's really a good point, because I think it's starting to pick up momentum. IV therapy is starting to become more and more, in the mainstream because of the fact that a lot of people do have gut issues. So as far as your ideas and implementation in helping men, especially specifically who are lost when it comes to their testosterone health, what are some of the symptoms they should be looking for that they may be deficient?
Yeah, that's a great question. So men and women suffer from low testosterone, and some of the main side effects or main things that people will complain of, especially like when they're around the age of 50, they're not able to concentrate. Mm-hmm. They get that beer belly. They're just not able to gain muscle like they used to, and their sex drive just like is zero. And their mood, they're not as enthusiastic as they used to be. They don't have the energy when they wake up in the morning to go to the gym or even to get their work done. So there's a lack of focus and memory loss that people might think, oh, this is part of normal aging, but it actually could just be signs of andropause for men and for women, menopause.
Men are going to completely deny that. I keep saying, you guys are having your monthly visitor, aren't you? It may not be physical, but I think every man has a monthly visitor, because there is that time in the month where you just want to stay clear of the guy, maybe for 2-3 days.
Low testosterone in women and men has more anxiety. They have more anxiety and depression. If you give a man testosterone when they're feeling like depressed, they'll as soon as they get the testosterone, they'll feel like a light bulb went on, and they're like, wow, I want to work out, I'm excited, and I'm getting better sleep. So it is a lot of these symptoms sound pretty vague, but it doesn't have to be this way. We don't have to feel this way as we age.
Yeah, it's amazing how you accept your new norm as you get older. You think this is something that we have to go through, but we don't. I mean, we should be healthy. I mean, we don't need to be suffering through pain and discomfort or, the woe is me feeling all the time. It's really interesting how we accept these so easily, but there is a solution. And I think people are still very on the fence when it comes to hormone therapy, because they don't know much about that, and they don't understand if they take something, is that synthetic, and is that synthetic going to be not accepted in the body, and is my body going to cause other side effects? With growth hormone, because, a lot of people do the growth hormone injection, in the fitness industry, that's what we do. There are some people in bodybuilding, they do steroids, they do all sorts of stuff, but growth hormone for some people aren't always a good idea, because they may have, their bodies may be more susceptible to growing tumors or other things. So you just got to be careful. It's not for everybody, but you have testosterone and estrogen. This is in everyone's body, and they need that to sustain life. It's more important, I feel. So I think hormone therapy is something that needs to be more out there for education, because I don't think it's out there enough.
Yeah, there is. You brought up a good point about synthetic versus bioidentical hormones. Yep. And for men, we offer testosterone injectables, but that is a synthetic form of testosterone, and it could have its own side effects. If you're doing injectables, you can have an increased blood count, like a thickening of the blood that could lead to, increased risk of heart attacks for some people, and also elevated liver enzymes as well, because it's synthetic. The way it's metabolized, it could, it's not going to cause liver failure, but I see that in men who have injectables. And then when I do pellets, we do creams and pellets. Those are bioidentical, and they're, when I say bioidentical, it's not like we're getting testosterone from an animal. It's derived from plants. Plants that are we do get estrogen from pregnant mares' urine, for example, Premarin. But bioidentical male and female hormones are derived from plant materials, and then it's the substrate that we're using to create the hormone. Mm-hmm. So the hormones that are in pellet form basically are just the pellet. The pellet just has testosterone, bioidentical testosterone, and it just releases over 4 to 6 months. For men, I typically do testosterone pellets, and it's just slow release, and that makes sure that they have a steady state throughout their whole, the time that they have it. When they're doing a pellet or an injection, you're just getting an injection every week, and then you have this peak and trough.
Right.
That feels really good when you're in like the beginning, like day 1, 2, 3, and then it goes down. But when I do the pellet therapy, you'll have consistent levels of testosterone. And when it starts to run out, that's when they come back to me 4 or 6 months later, and they're like, okay, I think I need to get more.
Right.
I need more testosterone. But yeah, there's like a huge difference between the pills that are offered for women as well who want hormone replacement, like they're getting, synthetic. It's almost like birth control pills, which are all synthetic. Right. But for women, I do a lot of creams as well. I do creams. And then if they want pellets, the pellets are easy. So the creams are for both men and women are possible to use. But it's, it depends on your skin. If you're going to absorb it, like some people are swimming all the time, like they're, sweaty. Sometimes creams are not a great option. So that's why I like pellets.
Well, I gotta say one more thing that you guys may not be able to do here yet because the U.S. hasn't approved this and it's not FDA approved, but I have to go to Mexico to get it done because I have fibromyalgia on top of some other things. But I went and got a stem cell, and it was mesenchymal stem cell from the umbilical cord, not the embryo, umbilical cord, which basically becomes what your body needs. And I gotta tell you something, my hormones went to a level like I was as a teenager. I mean, everything was up there and it was balanced. It wasn't like estrogen was high and the progesterone was low and the estrol was, everything went up together. My estrogen was like in the 500s. My progesterone was like 26. It was higher than a woman that's usually, who's pregnant, who has the hormone increase. My testosterone everything went up together beautifully, and it stayed that way for about 9 months. And
wow, that's amazing.
It was amazing. And they,
IV?
Yes, it was injectable. It gave me 50 million stem cells. In about a year, it turns into about 1 billion because it multiplies and does this thing. But I got to tell you, that was the one thing that was definite where I can gauge, because I did my blood work prior and I did my blood work after. And the fact that those numbers were like doubled from 260 something from my estrogen to 500 and what have you. It is incredible what stem cells can do. I know that there's a lot out there that says we need more facts, and the journals are written on it. But more on bone marrow and adipose tissue stem cells is what we're doing here in the U.S. But in other countries like Panama and Mexico and Thailand, they're doing the mesenchymal stem cell borrowed donor from another person. It was the most incredible experience I've ever had, and I know that sometime in the future, regenerative medicine will become a part of our mainstream, but it is incredible. So when it comes to hormone therapy that I've experienced, for me personally, with stem cells, it definitely increased my hormone capacity, which made me feel better for a period of time. But unfortunately, I think with the pellets, I think you need to get it done maybe every year just to get that effect.
I know there are lots of providers. Actually, Dr. Steve did actually offer stem cells. I think that it has a lot of potential. You just want to make sure you don't have any cancer in your body when you do stem cells. That is like a contraindication. And then the other thing is that there's another therapy called exosomes, and that's something I was thinking of offering because it's not derived from umbilical stem cells. You can get commercially, you can buy processed umbilical stem cells, and that's possible. But exosomes are actually the growth factors that they produce.
Right.
So you don't actually have to have the stem cells. Right. Injected. So exosomes are the next big thing, and I'm definitely interested in offering that to patients.
That's awesome, because I heard about that being started in UCLA, right? It was one of the doctors up there that was promoting that a year ago?
Yeah.
Oh, that's amazing. Yeah, bring it.
I think there's a lot of stuff out there.
Yeah, there's another one we do too, NAD therapy.
Yes, it's beautiful.
And I've been doing it for a while, and then it became, I think Joe Rogan had a podcast with a couple of folks on there talking about it, and next thing I know, my phone was lighting up of guys and gals looking to get this treatment. And kind of along the lines of, say, like stem cells, extending the telomeres on the end of the cells, which is basically giving your biological age,
Right.
how long the telomeres are.
Right.
And we can test that. I mean, so far it's one of the, there's not many ways of checking, your biological age, but this is one of the ways we've been doing it.
Right.
And so with NAD, it's reported that it can actually kind of help. Just like resveratrol was,
Right.
kind of when it first came out, was like, this is the anti-aging thing. And NAD does it differently. I mean, basically, you're kind of putting fuel into the mitochondria.
Right.
And you have to do it slow. It's a slow IV because people can feel it, and you don't want to go too fast with it. But
wow,
yeah, that's very popular.
You guys do the IV version, or you guys putting because I did the patch version, and that was a 4-hour thing. IV. Oh, wow, that's insane. That's great.
It's still slow depending on the dosage you're taking.
Right.
Some people can tolerate it a little bit faster than others. And, I use it for a variety of things, It's kind of a newer treatment. It was used for addiction therapy,
right.
and they still use it for addiction a lot of the time.
Right.
And it kind of switched over to we're going to start treating Lyme disease, general wellness, anti-aging, and I've been using it for kind of a number of different conditions. I would normally think it would be my first choice, but
right.
it works.
It does.
It works. And then,
well, it makes sense. Most people don't have a very functional cell system, especially the mitochondria, because if it doesn't turn over every 28 days and become a fresh new system, it dies. It kills. It dies in there and kills the cell. So, that makes perfect sense because NAD is a part of your energy system, and if you don't have that completed in the Krebs cycle, it doesn't give you that ATP production, which is the energy that comes out of the mitochondria. So if you don't have that, you don't have a body system that functions. So NAD is huge.
Yeah, it's kind of like testosterone. It does drop as we get older. Our NAD level,
right.
Our NAD levels will fall off gradually.
So listen, guys, I am so sad because we're at the end of the show and we're just starting to get into these great concepts of what you guys are doing there. But I definitely want to partner up with you again and get into these types of conversations because this is what fuels me as far as what's out there for options for people to get their body back into balance. And I think what you guys do is just tremendous. And I'm so appreciative of both of you sharing your knowledge and experience and what you are doing there currently. So we're so lucky to have you here in Hawaii. Your company is called Hawaii Natural Medicine, and you guys are located exactly where again?
We're at Century Square, Bishop and Beretania.
Okay. And
so right downtown.
Right down. Perfect. This is awesome. And your office number is 808-524-8715?
Yes.
Perfect. Listen, I am going to say thank you and goodbye to you now, but I'm going to put everything together on my website, and I'll YouTube this as well for the audience if they want to listen to this again, because this was really good information. And I'll definitely keep in touch with you guys. Thank you so much for coming and giving me your time. I know you both are busy. I hope to talk with you really soon.
Thank you very much.
Thank you.
Yes, bless you guys. Thank you guys. All right, guys. Thank you so much for tuning in. I wish you all the best. Take care of yourselves. Stay healthy and aloha.